Well, medical research, we're talking here about research largely on patients to see whether or not certain medications or certain technologies work better than what the conventional technologies are. So one of the challenges is funding, getting enough, all of medical care is under considerable scrutiny for doing things less expensively. And research is relatively expensive to do, so I would say getting the resources is one. Secondly, research has to be done in an environment where the patient understands exactly what the research is about, the physician understands, all of the medical team understands. So good communication, is another, I think, big challenge. And then the third is getting the time for the physician to have in order to do research. They have to be a clinician a certain percent of the time and do research a certain percent of the time. And in order to kind of carve out that piece of time is also another challenge. I'm the chairman of the department, so part of my job is to, give people enough time to do research. We just recently recruited one of the world's experts in structural heart disease. His name is Carlos Ruiz, R-U-I-Z, and I worked with him when I was in Illinois, and I heard that he was available, so he just joined us a couple of months ago. And a lot of what he does is research on what's the next step, what's the next catheter, what's the next wire, what's the next valve. Pretty soon we're going to be able to replace all these valves really without surgery, and Dr. Ruiz is an expert in that, but we've got to give him enough time in his day to be able to do that type of stuff. I think that's really kind of in the world of leadership and in the world of management, and making sure that people who can, it takes a special type of person to be able to take care of patients and do research at the same time. But Dr. Ruiz and others like him, are the types of people that we're looking for, and then manage their time so they can do it. What we have here is a program that starts out, as I mentioned, there's a spectrum. It starts out with prevention. And so we have a very robust preventive program. What are your lipids, your cholesterol? What is your blood sugar? Do you have diabetes? Do you smoke? Are you hypertensive? Do you have high blood pressure? And we have a whole host of people who specialize in preventive cardiology. We also have a host of women cardiologists who are part of the Women's Cardiac Institute. We actually have 11 women who are cardiologists here at Hackensack. I think that's the most, at least in this area. Women are different than men. When they develop heart disease, they have different symptoms, sometimes different manifestations, and you have to be aware of that in order to treat appropriately. But that's on the preventive end of the spectrum, and we have very much that end of the spectrum. We also enlist nutritionists to have people have a healthy diet. There's no question that diet makes a difference. That's how I consider we're going to prevent the disease. However, if you still develop the disease, then we've got the medications to treat you, and if the medications aren't sufficient, we've got the technology and the surgery to give you the best care.